know the feeling, right? That tiny little sore pops up inside your mouth, and suddenly it's all you can think about. Well, that's a canker sore, and they are one of the most common and, frankly, most annoying things that can happen in your mouth. So today, we're going to demystify them. Let's get into it. It's honestly kind of wild, isn't it? How something so incredibly small can pack such a painful punch. It can make eating your favorite foods, having a drink, or even just talking a total nightmare. So that leads us to the big questions we're tackling today. What exactly is this thing? And for those of you who get them all the time, why on earth does it keep coming back? That's what we're here to figure out. Okay, first things first, we've got to properly identify the culprit. What is a canker sore? And, just as important, what is it not? This right here is the #1 mix-up we've got to clear up. Canker sores are always inside your mouth. Think inner cheeks, your tongue, that kind of thing. And here's the key. They are not contagious. Cold sores, on the other hand, they're caused by a virus, usually show up outside the mouth, and you can definitely spread them. They are completely different beasts. So the technical kind of fancy name for a canker sore is an aphthous ulcer. All that really means is it's a harmless, non-contagious sore. You'll know it when you see it. It's usually that classic round, shallow spot, kind of white or yellowish in the middle with a bright red ring around it. But wait, there's more. Not all canker sores are created equal. They actually come in 3 main flavors. The one most of us are familiar with is the minor type. That's about 85% of all cases. Then you've got the bigger, meaner, major type at 10%, and a really rare one called Herpetiform making up the last 5%. And here's how they stack up. Minor sores, they're small, they heal up in a week or 2, and they don't leave a mark. Major sores, though, they're bigger, they dig deeper, can hang around for a month or even longer, and yeah, they can leave a scar. And those herpetiform ones, they look like a tiny cluster of sores that can all merge together, but luckily, they also tend to heal up without scarring. So, that's the what. Now for the big why. Why do these things even show up in the first place? Well, the exact cause is still a bit of a mystery, but we have a lot of clues. First off, if you get them, you are in very, very good company. It's thought that about 1 in 5 people deals with them, so yeah, it's an extremely common thing. The leading theory right now points to our own immune system. The best way to picture it is like your body's internal security system just gets its wires crossed. For some reason, it mistakes the healthy cells in your mouth for an enemy and attacks, and poof, you've got an ulcer. It's basically a case of friendly fire. So what pulls the trigger on this immune system mix-up? We've got a whole list of usual suspects. For a lot of people, it's plain old stress. For others, it's a small injury, like when you accidentally bite your cheek. We've all been there, or even just scrape it with your toothbrush. Lacking certain nutrients like iron or B12 can do it too, and so can food allergies. And then there's your family tree. If you get canker sores, there's a really good chance other people in your family do too. In fact, about 40% of people who get them have a family history, which points to a strong genetic link. So yeah, you might be able to thank your parents for this one. Now, for most of us, canker sores are just an annoying, painful blip on the radar. But for a small group of people, they can actually be a clue, a sign that there's something deeper going on in the body. And that brings up a really important question. If you're someone who gets these sores over and over again, could it be more than just a local problem? Could it actually be your body trying to tell you something about your overall health? It turns out there are several diseases that can show up with mouth ulcers that look exactly like canker sores. Things like autoimmune conditions, celiac disease is a big one, and sometimes the sores are the only sign. Also inflammatory bowel diseases like Crohn's, or a rare condition called Behçet's disease. Okay, enough investigating. We've identified the culprit, we've looked at the causes. Now for the part you've been waiting for. What can you actually do about them? It's time to open up the management toolkit. For most of those minor sores, simple at-home care can work wonders. Here's a 3-step game plan. Step 1. Lay off any food that's going to make it angry, so anything super spicy, salty, or acidic. Step 2. A simple, warm saltwater rinse a few times a day is amazing for cleaning the area and soothing the pain. And step 3, you can find over-the-counter gels or patches to apply right on the sore for some relief. Now, there are different levels of firepower here. Your over-the-counter options usually have something like benzocaine, which just numbs the area. But if you have a really severe case, or they just won't go away, a doctor can prescribe much stronger stuff, like topical corticosteroids. These are heavy-duty anti-inflammatories that calm down that immune response and really speed up healing. While most of these sores are harmless and go away on their own, there are definitely times when you should stop playing detective and go consult an expert witness. And by that, I mean your doctor or dentist. So, when is it time to make that call? Here are the big red flags. If a sore sticks around for more than 2 weeks, if the sores are huge or incredibly painful, if new ones keep popping up before the old ones even heal, or if you're getting other symptoms like a fever, it's time to get it checked out. And that really brings us full circle. We've seen the canker sores can be set off by all sorts of things, from the food you eat and your stress levels to your own genetics. The key to managing them is often becoming your own health detective. So, the final question is for you. After all this, what do you think your personal triggers might be? Something to chew on.